Genetic testing is getting better. In recent trials, genetic tests helped predict the risk of heart problems, including sudden cardiac death. But this technology is still new and in some cases unproven.
9 News medical expert Dr. Coley is here to talk more about this. So we're going to start with the basics, Dr. Coley. What is genetic testing and what can it really tell you?
So genetic testing is usually a blood test that looks at your DNA, your genes that you get from your parents, and it tells you essentially what your risk of heart disease could be. So it can look forward and predict risks of heart disease, of cancer, of other types of illnesses. Or we can use it to look backwards. So sometimes if somebody presents with some clinical symptoms, for example, and we think they may have something like Huntington's, which is related to a genetic defect, we actually then check their genes to confirm the diagnosis. But I always tell people your genes are your hardware, and the way you turn them on, the way you live your life is the software. That's called epigenetics. So it's not 100% what's in your genes is necessarily what's going to happen in the future.
Someone's probably listening to this and like, wait a second, I can do a blood test and I will know all of my markers and I will know all the things, but this isn't always recommended.
Oh, in fact, it's not recommended at all in the guidelines because there's very few diseases that are linked to a single gene defect. Now, some things are such as breast cancer with the BRCA gene, Huntington's, as I alluded to, but most of our diseases are polygenic, meaning many genes are involved in predicting. The second reason is you get a blood test, okay, it comes out negative for that gene, you have false security that you're not going to go on to develop that disease. It comes out positive and you have this dagger hanging over your head and you may never end up going on to get that disease. Or it can come out what's called variant of uncertain significance, meaning you have this kind of typo or change in your gene and they don't know what that means. And then you've got all the emotional baggage that goes with that, not to mention the implications for your family, the implications for health insurance coverage and all the other things that come with it.
I guess I'm not even certain now who's doing the testing. Is this something that's done through your family doctor, or do you have to use one of those companies like 23andMe?
Do not use those companies like 23andMe. So if you've ever thought about getting genetic testing, talk to your doctor. Sometimes I will do genetic testing for some people. So for example, if you have a strong family history of early onset cancer, if you've had cancer before the age of 50, you've had multiple cancers, these are all reasons to test for cancer genes. Now only 5 to 10% of cancer is caused by genes. So you don't necessarily want to test it if you don't have that type of history. But there is a genetic test for heart disease, for example, that I'm doing in every single one of my patients that walks through the door, whether it's for palpitations or for leg swelling or shortness of breath or what have you, and that's called lipoprotein A. So that's a test that every single person needs to get. Now that's a different type of a test. It's not necessarily looking at a single gene, it's just looking at this marker that predicts heart attack and stroke risk and what have you. And then for Alzheimer's, we of course have the ApoE4 gene test, which a lot of people, it's very controversial, but a lot of people who have Alzheimer's in their family are thinking of getting. If you have one bad copy, you got a target sign on you. If you have 2 bad copies, it's a huge target sign. But even then, you may not go on to get that Alzheimer's.
I mean, they say all the time, early detection is key, right? Like that is so important to pay attention to your body, make sure you're going to your doctors. But it sounds like this isn't far enough along. Do you think there'll be a point in time where there is a very simple like blood test scan for everything?
I do think so. And I think we're getting closer than you think. So for example, sometimes for some of my complex heart disease patients, I will do what's called a polygenic risk score. So rather than just checking for one gene and saying, oh, do you have this particular disease? It's a risk score that looks at many different genes, looks at all the variations of the different genes and uses a predictive algorithm to then come up with your risk for diabetes, your risk for heart attack, your risk for stroke, as a way for me to then intensify risk factor management. So it's almost a way to inform the doctor's choices, because one of the other challenges we have with genetic testing is the so what. So if it comes out positive, we don't have a treatment, what do we do different? Especially if it's not a crystal ball, it's not necessarily going to play out. So I think we're getting a lot closer than you think. I think for anyone who's considering genetic testing, sit down and talk to your doctor, because certain genes, like I said, that lipoprotein A I'm doing in everyone, polygenic for heart disease, you can think about some of the cancer genes you can think about, but going on these consumer websites and doing it can really get you in trouble because there was a data leak with that, so you don't know what happens to your information. You don't know what the implications are. Once you get a genetic diagnosis of carrying a gene, they can raise your health insurance premiums, they can, because it's part of your medical record.
Right.
So you really want to be responsible with this type of information. But genetics are just a part of our overall health picture, but such an important part.
Lots of good information this morning on an often talked about topic. Dr. Coley, thanks for joining us here on this Tuesday.